Hey everyone, I just want to do a quick video regarding my view with chest pains and in triage. So whether you're a new nurse or like new to the department, new grad, anything, hopefully this video helps you in any shape or form. So pretty much with me, remember your PQRST, assessment questions. And for me, normally I would ask them like, oh, when did it start? Can you describe it for me? Does it radiate anywhere? Out of 1 to 10, how bad is it? Has it ever happened before? Do you take any blood thinners? Really important to ask for blood thinners for patients with having like chest pain because they can have already a past medical history of cardiac procedures, and ask for any surgeries, any heart surgeries, any recent surgeries, because you can, if they had a recent surgery, you can also think like, oh, it could be like maybe a PE as well. Have they traveled recently? Because if there's like any air flights and stuff like that, there's like a risk for DVT if it's like a long flight and stuff like that. Any allergies is important as well. I also regarding like any cardiologist appointments that they've gone to, or how how apart they schedule their appointments. Because if it's like, oh, it's every once a year, that at least tells me like, okay, they're pretty compliant, or at least like they're very well managed. But they tell me like, oh, it's every 2 months or every 6 months, or I do have like a prolonged history, then that's already kind of like your red alarm into this patient with this presentation. Regarding vital signs, you can ask the patient regarding like the vital signs. I normally take them on both arms if something is off. If they tell me like a chest pain rating to the back, I normally do like bilateral blood pressures, and then also check like their radial pulse as well, just to like kind of like low key reload at AAA. Remember, triage, you will normally have like 10 minutes or less to do like everything. So it's really important to have your assessment pretty spot on and be pretty much confident on what you are sending the patient to. If it's a bed or it's a waiting room, it's a hallway chair. Once you're doing that, we normally have a protocol for chest pain, CBC, CMP, troponin, chest x-ray, and EKG that a nurse can order protocol under a doctor's name. So as the EKG is being done, really try and see like if there's any ST elevations on the leads, and if there is, then you already have your STEMI there. If it's normal but it's still pretty consistent, everything that the patient's telling you, you can also think that they're having an NSTEMI, which an NSTEMI is pretty much kind of like a heart attack as well, but it's only coming with the troponin. The troponin level is high or it's above normal, and the EKG looks normal. Eventually, the EKG will be showing ST elevations, but I mean that's pretty much the big difference between an STEMI and an NSTEMI. The STEMI you will see right off the bat in the EKG with elevation on certain leads, but if it's an epigastric pain, for me that's still for me a chest, so I would still do an EKG if it's epigastric pain. And even if they tell me they have heartburn and stuff like that, I would just do it, because a lot of times I've had patients with an actual STEMI and leads to 3 AVF, which is the inferior part of the abdomen. So really important to have that in mind. And yeah, that's pretty much it. Thank you so much, guys, for watching. I'll see you guys into the next video. Bye bye.